Yvonne Ndukwe has been dealing with bouts of malaria, but visiting a hospital for treatment hasn't been an option since the coronavirus outbreak. She recently got an alternative, a telemedicine platform that enables her to communicate with a doctor. The platform also links her with a pharmacy around her neighborhood from where she gets her drugs, and the service costs about $2 monthly.
I registered with 3,000 naira for 3 months, and I mean that is really affordable. Imagine for the next 3 months I get access to malaria test and treatment, and then I also get an opportunity to chat with the doctors.
We receive prescriptions for patients who have visited an online doctor. Then we fill the prescriptions and ensure that the drugs that we give the clients or the patients or customer is exactly what was prescribed, and we tell them how to take it.
The platform also covers chronic health conditions.
What happens is we have this set of symptoms. We have an algorithm that we use. We have an algorithm that we follow depending on what the patient complains about. And with this, we're able to make a diagnosis. Now, if the complaints they have are not one of the diagnoses covered by the telemedicine app, maybe it's one of those that would need a specialist recommendation. We offer them a referral template, like a referral letter, which they can take to another facility or a clinic.
The platform is the brainchild of health tech firm Wella Health, alongside its health insurance partner, Reliance. It's a pathway that's helping thousands of Nigerians access quality health care from the comfort of their homes. The partnership has served over 4,000 patients since it was launched some 50 days ago.
So it's really simple to use. It's just the same way you can chat with your friend or your colleagues at work. Just pick up your phone and talk to them via text messaging. For people who aren't technologically savvy or do not have a smartphone, we also have the facility to connect you via voice to a doctor. There's value for everybody involved. There's value for the patient. They don't have to go to a hospital. They don't have to wait on long queues. They just talk to a doctor, pick up their medications.
The telemedicine app was launched in the height of the pandemic. Because of the lockdown, people could not go out. People were scared. A lot of people had this panic about the pandemic, and hospitals were also very, very cautious about who comes into the clinic and who they attend to. So at that period, we were able to provide maximum value to all our users to minimize the number of hospital visits that happened in that period.
Nigeria's fragile healthcare system has been badly affected by the impact of the coronavirus pandemic. Reports from the Bureau of Statistics show that about 82 million people live below the poverty line of $1 per day. That's about 40% of the country's population. Now, the telemedicine platform seeks to increase access to healthcare for middle to low-income earners. Kelechi Emekalam, CGTN Abuja, Nigeria.